You've been referred to me by Dr. Roberts for a thorough ear cleaning. My name's Sean. I'll be your clinician today. And basically what we'll be doing is we'll be getting in there and making sure that it's all tickety-boo and everything's operating as it should be. We'll be using a number of tools today. I'll show you some of them just so you know what's going on. The first thing we'll do, as usual, as I'm sure you're used to, is just taking a quick look in your ear with the otoscope, which just sets out a ray of light like that, just to see exactly what we're dealing with. Following that, and based on the severity of any earwax build-up or anything else that might be in there, what we'll be doing is using some active formula organic eardrops. Now these will just help to dissolve and soften up any hardened earwax that might be secreted within the ear canal. Okay? After that, what we'll be doing is getting in there, and this might look a little bit intimidating, but don't worry too much. It's not a particularly big part of the process, with some tools just to get rid of any large deposits of earwax. So we'll be using tweezers and just a little scraping tool just to clear any debris out of the ear. And then we'll be using Q-tips to just wipe the ear and make sure it's as clean as possible before finishing off with some wipes just to clean you down. Okay, how does that sound? Good. Now, just before we begin, I thought it might be a good idea to talk about some of the functionality of the ear to give you a better idea of exactly why we're doing this. So as you know, the ear is kind of split up into three sections. You've got the outer ear, which is the gubbins that you can see, and I'll talk more about that as I'm looking closely at your ear. Okay? Then you've got the middle ear and the inner ear. Now the middle ear is basically just the ear canal with the temporal bone on the extraneous element of it, leading to the tympanic membrane, your eardrum. Okay? Then after that is the inner ear, and that's got all of the bones and nerves that translate sound to the brain so that you can hear what's going on. Okay? And just to explain very briefly, what happens is sound goes through the outer ear, which is kind of a cone almost. You know, like in those old films, you used to see old people holding something up to their ear in order to hear better. It kind of operates like that. So it brings in the sound, and the eardrum translates that sound into waves, which then get to the ossicles. And the ossicles are just all the little bones and stuff within your ear. So you've got the after the tympanic membrane, you've got the eustachian tube, the cochlea, and the vestibulocular nerve as well, which I didn't pronounce correctly, but never mind. And within that, you've got those tiny little bones that you've probably heard of, which are the ossicles, which are the malleus, which is the hammer, the incus, which is the anvil, and the stapes, which is the stirrup. And those are the smallest bones in the body, and they're very sensitive. But what they do is they cause those sound waves to make little hairs move within your ear, which then sends chemical signals to the brain, and which then tells the brain what it's hearing. And we need to make sure that all of that works together in tandem to get those sound waves and that information to your brain as clearly as possible. And one of the ways we do that is just by performing a little cleaning every now and again. We don't want to remove too much earwax, as I'll explain, but I think I've spoken enough. Let's get straight in. Sorry to go on, I just think it's useful sometimes for patients to know exactly why we're doing what we're doing. Okay, so first off, let's get in there and have a little look. So as I said before, this otoscope It's just quite a bright little light. I'll be shining into your ear just to take a look. And when I'm close to your ears, I'll be speaking very quietly. I'll be whispering so that I don't damage or irritate you. I mean, I might irritate you as a person, but I don't want to irritate your ears with too much sound. Okay? Alright, let's get started. All you need to do is sit back, relax, just let me get to work. And if I ask you any questions, reply, but otherwise, just take it easy. Okay? Right. So I'm going to start by looking into your left ear to see what we're dealing with. Okay? Okay. And here we see the outer ear is made up of a bunch of different bits. Okay? So you've got your helix, your antihelix, the concha, the antitragus, the tragus, and the lobule, which we, of course, call the earlobe. And I'm just going to just touch the ear in places and pull it back in order to get a better look inside. Okay? And I can see here there's a little bit of a build-up of wax, but it's nothing to worry about. I think it'll get do with a good clean. And what I'll do is push your tragus down temporarily. And we're off again. Good. And just palpate a little bit around here. How does that feel? Okay. Okay. We'll just take another look in the other ear, if you'll bear with me. Okay. And again, when just looking at the different bits, just touching them gently. Shouldn't feel any good discomfort or anything like that. Just like the concha. And we can see, just pull the lobule a little bit. Okay, yeah, seems fine. There's still a little bit of a build-up of wax, but not quite as bad as the other ear, which is good. But we'll still give them a thorough cleaning either way. I'll push down on the tragus. There we go. And let go. There we go. That's it. And it's looking pretty good. Okay. Excellent. So, everything's looking as I would expect. There's a slight build-up of cerumen or earwax, but that's normal. Now with earwax, it is actually a natural antibiotic. So what we don't want to do is completely clear out every single part of it. We just want to get rid of any excess that might be impeding your hearing, or could, in fact, even present the risk of infection. That's probably the reason why Dr. Roberts referred you to me. So what we'll do, the first thing, is to administer these ear drops. Now, as I said, it uses an active form known as organic. So there's nothing to worry about. And what we're going to do is put 2 drops in each ear. Okay? Now, you might feel a little bit of discomfort, but what we're going to do out of that is just press the tragus down a little bit just by your ear here to seal in the eardrop. And this will just help to make the earwax more malleable so that we can get it out a bit easier. Okay? So if I can ask you first, we're going to do the left ear first. So if you can just lean your head to the right a little bit. And we'll put 2 drops in, okay? Right, thank you. You ready? 1, 2. Okay. Good. And in the other ear. Ready? Lean your head to the left. 1, 2. Good. Now what I'm going to do is on both sides of your ears, just press the tragus down just for 10 seconds, and I'll count to 10, and that'll just help the fluid to settle and start disintegrating some of the excess earwax. Okay, so ready? I'll count down to 3, then count to 10. 3, 2, 1. 10. There we go. Now, while that's settling, let's just take a look at your ears. So what I'm going to do, just very briefly, is massage your ears to limber them up for when I'm going to be going in with some of the tools. Okay? Again, you shouldn't feel any discomfort. I'm going to do massage along the helix, which is the outer ear, down to the lobe. And back up to the top of the helix. Okay, good. Now, that treatment should have settled in by now. So what we're going to do, I'm going to grab these tools. And first of all, I'm going to scrape with this. Okay? Now, as I said, it looks a bit intimidating, but don't worry. It won't hurt. I'll just be using it, not even topically. I won't be actually touching your eardrum or anything like that. I'll just be using it to gently scrape excess earwax. Okay? So we'll start with your left ear. Alright, here we go. Okay, and just gently clear the ear canal. And just the other side. all with that. Nasty one. So what we're going to do now, and again I'm pretty intimidating to look at, I'm just going to pop these in and pick out any large bits of debris or earwax that might be in there blocking your ear canal. Okay, start with your left ear. I'm just going to pull the ears. Sorry. So that's the left hand side done. Now to the right hand side. Same again. So get your ears ready. Okay, here we go. So it's all looking pretty good in there. Just one more time, what I'd like to do is take a Q-tip for each ear. So very quickly, just in each ear, I'll be getting in with this so that we can just clean up any remaining wet earwax. Okay, here we go. Just going to peel back your ear. this one. Get a new one. And the same on the other ear. Okay. Alright, and finally I'm just going to use a couple of wipes just to wipe down the external regions of the ear, the outer ear. Okay? Okay, and the other ear. Okay, good. How do your ears feel? You okay? No discomfort or anything like that? Okay, good. Okay, excellent. Well, I think we are done. Thank you very much for coming in. I hope this has been helpful. I hope that your ears feel okay and that you can hopefully hear a little bit better. And it should help you to protect against any infection or anything like that. So thanks again, and I hope you have a wonderful day. Okay, bye.